I just left the grocery store on my way in, and I'm sure you see it too. Lots of people wearing gloves right now. Some of them even inside their homes trying to stay protected from the coronavirus. But do they actually keep you safe? WMAR 2 News' Aaron McPherson has the answer and more ways that you can practice proper hygiene.
The CDC recommends everyone wear a mask to prevent the spread of the coronavirus, since people who aren't showing any symptoms can transmit the virus.
Although we're not utilizing these masks to protect ourselves, we're basically protecting our community as a whole by wearing masks. Because it's a respiratory droplet, and the thought is that it's creating a sieve or another barrier for the droplet to pass through.
Dr. Venetia Amin is a hospital medicine physician from the University of Maryland Upper Chesapeake. There, in addition to wearing masks, they wear gowns and gloves when in contact with positive patients.
We're, discarding the personal protective gear that we're using. This is for patient safety, this is for personnel safety, this is for staff member safety.
Using protective gear properly and disposing of it correctly is important to avoid cross-contamination. Dr. Amin says when you take off your gloves, you have to keep the germs locked inside. So you go with the little lip at the bottom, grab it, turn your glove inside out, put it inside the next glove, and then same thing on the other side. Turn your glove inside out, locking all those germs inside, and then throw it in the trash.
Many times what people are doing, they'll have gloves on, they're still touching their face. They'll have gloves on and they'll take them off and then put them back on to use their cell phones.
She says gloves only need to be worn by a healthcare provider or if someone is taking care of a COVID-19 patient at home. Otherwise, gloves really aren't needed.
So as soon as it lands on surfaces, the amount of virus significantly drops to less than 0.1%. So even though it's detectable and it's there for long periods of time, we don't really necessarily have data to support transmission from surface to human.
The virus needs a person to survive, so Dr. Amin says the best way to stay safe is practicing good hand hygiene. Use hand sanitizer with at least 60% alcohol content.
Don't touch surfaces while your hands are still wet from the sanitizer. Just rub it till the content is dry for the most effective and efficient use.
Also, use sanitizing wipes.
Wipe down your steering wheel, wipe down your seat. Those are better precautionary measures than utilizing gloves, which really is just a false sense of assurance that you're doing something right.
And of course, wash your hands. Dr. Amin showed us the proper way. Add a little bit of soap, some water, then rub together your palms, soap on the back of your hands, in between your fingers, thumb crevices, nail beds, top and underneath. And the final is the wrists. She says to do this for 20 seconds or 2 happy birthday songs. And while this is very effective, she says the best disease containment strategy is social distancing. Reporting from my kitchen, Aaron McPherson, WMAR 2 News.